Join the conversation on at Nigeria Info FM. On WhatsApp, our line is 0809 597 5805. It's 0809 597 5805. I'm Sheriff Quadry. Thank you for joining us.
Welcome. I'm Wemimo Adewuni, and I'm looking forward to this conversation. Fibroid and infertility in Nigeria, and it's a big issue. I hope that you'll be calling and we have a doctor joining us. While we can't do diagnoses on the show, we'll try to answer as many of the questions and concerns.
Keep them coming in. Keep them coming in. Keep
you
sending those thoughts right now. We want to have them.
The
yes,
WhatsApp
to
line
WhatsApp,
is open.
right.
And you got the number earlier on. Again, it's 08095975805. Twitter is at Nigeria Info FM. We're also streaming live on Facebook and YouTube now. And you can also drop your comments right there. Medically, researchers have shown that infertility has been a very serious problem in sub-Saharan region of Africa for a long time. This is perhaps because there are rampant cases of infertility in the sub-region of the continent. Now, scientific research and findings have indicated that one of the problems associated with infertility amongst women is the prevalence of fibroid. This is as a result of the fact that fibroid is a non-cancerous growth that develops in or around the womb, which is the uterus of a woman. Like we told you earlier on the show, the whole team spent time yesterday watching videos and just looking around and saying, what exactly is this fibroid? Can we just understand a bit more?
We're just curious, and we found out a lot.
And that's why we have a doctor in here today who'd also be helping us understanding some more. And for those who have fibroid issues, what can they do? And those who have infertility issues, what can they do? We have Dr. Ife Atuchuku joining us from the Medical Arts Center. Good morning, Ife.
Good morning.
Thanks for coming in. Before we go ahead, there's a report. I did this report quite a number of years ago, interestingly. But fibroid is not going away anytime soon, I guess.
No, it's not.
But we'll let you listen to this. It answers some of the questions, and we'll be listening to more after this. 1 in every 5 women of childbearing age have fibroid. Although the National Population Commission puts the total fertility rate in Nigeria at 5.7, medical experts note a decline in this rate. Research has also shown a link between infertility and polygamy in Nigeria. Instead of proper management of male fertility, polygamy seems a more acceptable option. Professor Oladapo Ashiru is a consultant, medically assisted reproductive technology center, specializing in vitro fertilization of embryo in humans. He explains what infertility is and when a couple can be described as infertile.
Infertility is no different from having diabetes, hypertension. They should meet during the ovulatory time, which is about mid-cycle, at least 3 times to 4 times a week during that period of ovulation every month for 9 months. Once that is done and there's no conception, then there's a problem.
According to estimates, about 5 to 10% of infertile women have fibroids. Fibroids are non-cancerous tumors that grow from the muscle layers of the womb. Fibroids vary in size, some as small as a bean, while some are as huge as a melon. Although women of reproductive age are most likely to develop fibroid, overweight and obese women have a significantly higher risk of developing fibroids. Culturally, infertility causes stigma to the woman and has led to the breakup of many marriages in Nigeria. Mrs. Sheifumi Adebiyi shares a traumatic experience for 4 years.
I was outside the room, just was that. The hospital, they did not take anything. They just told me to go and operate. That was the only option to get. I was trying to look for solution and I stumbled into the foreign drugs that they call scientific. I didn't want to operate because of fear or complications. So I hope women who have to tell them if they can have 1 or 2 children alongside the marriage and go and operate. That there's every tendency that you might go and operate and damage some vital organs in your body that will end up being barren for life.
Her husband, Mr. Shola Adebiyi, discusses the impact on the family's finances.
Because it's going to experience and some we use of allergy medicine, but when we use it for about 3 months, it's not even reduced, so we have to stop the drug. One charge is 10,000 naira. We use every 3 hours.
Drug worth 10,000 naira to be used every 3 hours. That's one of the alternatives that people seek in treating fibroids.
And that's just one person. Imagine what others are going through.
10,000 naira.
Fibroid and things, information that are out there about how they can shrink fibroid. Is that even a possibility? Well, that's why we've got our guest in the studio this morning.
Right, let's kickstart the conversation. Dr. Ife, let's start by asking, what precisely is fibroid?
Okay, so fibroids are growths or tumors that arise from the muscle, mostly from the smooth muscle layers in the uterus. So it's an abnormal growth, like I previously said. And I don't want people to get scared when they hear tumor, because that's the common term sometimes you use to describe fibroids. Because when they hear tumor, they'll be like, oh, that means it's something bad.
Right.
But I'd like to stress that though it's a tumor, it is not cancerous, okay? Which means it doesn't spread. It's not going to affect any other organs or anything else in the body. It is just there, confined within the structure of the uterus.
What causes it? What causes fibroid?
Well, you have predisposing factors to it, that things that can make you likely to have them, which is if you're an African or Black American, it is more common with us.
Okay.
Also, the
just because we're black,
right?
Yes. Just because we're black.
Yes.
That's not fair.
Well, I mean, I'm sure the Caucasians also have things that they very common with them, yes, and it doesn't really affect us, So just being black, you're already predisposed to having it. If you're at the reproductive age, again, but recently there's something I just stumbled into. They said soybean milk can predispose you to having fibroids.
Is that verified?
Well, not really. I think it's just a research that came out not recently, actually.
Okay.
So I think they're still looking into it to verify if it is real. But some school of thought is saying that you're, predisposed to having fibroids if you consume a lot of soybean milk.
So if you're in the reproductive age, if you're black, what are the other things that we can say or medically can cause it, apart from those two causes?
Oh, well, there is nothing actually that causes it. It's just for the fact that, like I mentioned earlier, you're black, you're already at risk of having it. There is nothing that you take, or apart from this new thing we've seen now, that exactly that will make you, because it's just a growth. It's the normal cells in your body. It's just like it is growing faster than it should.
Is it hereditary?
Yes, of course, it is hereditary as well. Yes, it is. So if it falls from the family, if you're maybe your mom, or if it runs in the family, you are also at risk of having it. Yes.
Oh wow, what is such a thing? Now, while we were looking around the internet yesterday, we saw there are various types of fibroids.
Yes.
And we looked at some videos that were a bit scary. So when you look at those videos, you saw that some of them are in clusters in the uterus, some outside of the uterus. So what are the types of fibroids that there are? And are some easier to treat than others?
Well, yes. Currently, we have four types of fibroids. You have the subserosal, which are the ones that grow out the outlining of outside of the fibroid lining. Then you have the intramural. Those ones are within the muscles of the uterus. And then, of course, you have the submucous. Those ones are the ones that kind of project into the uterine cavity.
Oh, wow.
And then you have the pedunculated ones. Those they kind of have stalk. So that's why they call pedunculated, because they are not just rounded. They are rounded, and then they have a little stalk that connects them to the uterus.
Oh, goodness.
Yes.
Can fibroids be deadly?
Well, if it's big and it is compressing on the nearby organs, okay, so if it's so big that it can compress the rectal region, of course, the patient will be constipated, you won't have, or even it can cause frequent urination if it is affecting
The bladder.
So it all depends on the degree, but it's not deadly. You can't just die just because you have fibroids.
Okay.
And also you'll be worried, because if you have a very large fibroid like that, then of course you have the tendency of having very heavy menstrual, flow. And I've had some patients that have come in and complained of fainting spells just because they've bled so much.
Oh, yeah.
Of every menstrual cycle is a problem.
Wow.
Are there symptoms? Are there signals that women should watch out for?
Yes.
Because, like you said, it's something that it's not there in your face. It's just there in your body. But are there things that can indicate that someone is having fibroids?
Yeah, well, fibroid, like I said, it can be very asymptomatic. So, which means you can have it and you don't know, and you go on and have all the children that you desire to have. Yes. So some of them can be asymptomatic. Okay. Yeah, there are some that are symptomatic. When they come in and complain, oh, again, I'm having these very heavy bleeds. I am having intercycle bleeds. So, you're supposed to have your cycle, the standard woman, 28 days. So some will complain that they're having intermenstrual cycles. In between, they may spot a bit. So some may complain of pain. Okay. Some may even tell you that I feel this hard mass. Somewhere, if I touch my lower abdomen, I may feel this hard mass there. Yes. So these are the little questions you want to ask, and when you go further into it, because you just can't make the diagnosis of, you have to make a complete diagnosis by doing your physical examination and then also going to imaging, because these are the things you want
because
to do.
the scan then shows you what's really going on.
Exactly.
But it looks like the fibroid, is there just because it's a uterus, which means men can't have fibroids.
Of course.
So, and it can't grow in any other part of the body aside around the uterus?
Yes, that's why I said it is from the smooth muscles of the uterus. Yes. And fibroid itself is one of the causes of infertility in women. So, of course, there are two causes of infertility. It has to be the male factor and of the female factor. The fibroid is just one of the female factors, because you can have other things like polycystic ovarian disease, endometriosis. There are a whole lot of other reasons. Yes.
How can fibroid cause infertility in women?
Well, it depends on the type of fibroids now. So that you have fibroids is not enough to say that it's, knock on wood, that once you have fibroid, you become infertile. That's not true. Okay. Women have had fibroids and have gone on to have children as much as they want over so many years. Okay. So, but the fibroids that you need to be worried about are the ones that affect the endometrial cavity. So those are, which I mentioned earlier, are the submucous ones. So they are the ones that you should be worried about. If they distort the contour of the cervix or of the uterine cavity, of course, it will cause infertility. If they are located in such a place that they block the tubes, because sometimes they can grow in such a place that they'll block the fallopian tubes. Of course, the patient cannot conceive naturally.
They can block the fallopian tube,
yes,
the passage.
They are situated in such a way that, because if you're going down, you're going from the cervix to the uterus and then, of course, to the fallopian. That's the flow that the sperm needs to go. Right. So if the fibroids are located in such a way that they are very close and they're kind of blocking the tubes, of course, essentially fertility takes place in the ampulla part of the fallopian tube. So if you can't go there, then
nothing happens.
Exactly.
So far we've explained a bit about what fibroids is. Dr. Ify has done quite some work, but let's see how much you've understood so far as we've gone. We'll open the phone lines and hear from you what you understand by fibroids. We come to talk about the herbal remedies, all the other things, the supplements, everything everyone tries out in trying to deal with fibroids. But we'd like you to join the show right now. We'll give you the phone numbers. Here they are.
Call us on 01-277-0993, 01-277-1993, 01-277-2993, and 01-277-3993. This is Nigeria Info. We are listening.
This is Nigeria Info. We are listening. Fibroid is one of the biggest issues women have, and it's just look at the phone lines.
You know why I'm smiling, right? I'm trying to think whether I will have more of male callers than female callers.
Let's see. Let's see.
Let's see who's here. Hello, good morning to you. Hello, good morning.
Hello, good morning.
Good morning.
Good morning.
Okay, my name is Edna. I'm calling from...
You need to put off your radio
can you
very
radio?
quickly, please.
Very quickly, please.
All right.
Thank you.
You're welcome.
You ready? What's your name again?
Edna from Ikorodu.
Welcome, Ebina.
Okay. Thank you very much for the insight. Actually, I had fibroids some months back.
Okay.
I took some drugs and it didn't work, so I actually went for a surgery.
Okay.
But I want to ask, because doctor told me it took me like 3 months to recover, and something was inserted inside my body that I can't do saying to.
Something was inserted in your body?
Hello, Edna.
Ebina. Oh.
Edna, are you there?
Yes, I can.
Okay.
You said something was inserted in your body?
Yes.
What for? What was that for? Did you tell? Well, you told what it's for.
He said it's to avoid the tubes or my womb being blocked or something.
While you were on treatment?
Still now, up to now.
Edna, can you repeat that, please?
The doctor said it's to avoid, I think, my tube or my womb or something to avoid being blocked.
To avoid being blocked.
But you had a surgery to remove the
Yes, I did.
fibroid.
Yes.
Okay, so are you worried about anything now?
I'm actually worried because going about with that thing, I'm not really comfortable with it.
Can you feel the presence of that thing in your body?
I do. I do.
Okay.
I think.
Edna,
what-
thanks
I
for
don't know.
calling. Just stay on the line,
please.
right?
The
Just stay on the
doctor
line.
there, I don't know if you can throw more light on that. I don't know if she's a doctor.
Yes, she is.
She'll be talking about that right now, okay?
Oh,
Thank you. Dr. Efe?
So I'm thinking that what they probably put there will be an IUCD, because sometimes when
But how come she
said-
feels an IUCD? You shouldn't
No,
be feeling.
I mean, I think if she puts her hand inside, she could feel it. you
Okay.
know. Yes, I'm thinking that post surgery, sometimes they put that. What they don't want to happen is because when you have a surgery, the place it will be a bit scarred, so you don't want the uterus to heal
And close
And
up.
close up.
Yes, so I'm thinking that's probably what was inserted
Right.
there.
And
to-
if you
to
have more
prevent-
concerns,
She should be worried.
Yeah, I don't think she should be worried. Usually, she's had it for once. Usually, they
About
put it
3
there 1
months?
to 3 months, yes,
Yeah.
and then they eventually take it off, depending. Okay, which type they use. Some use copper T, some will use Foley's catheter. It all depends on the
Right.
degree of what the surgery. But I don't think she should be worried. And if she's worried, she should go back to her doctor and maybe ask for more explanation.
Absolutely.
Yes.
Edna,
Thank
there you go. Hello, good morning to you. Hello, good morning.
Hello, good morning.
Good
Good morning.
morning.
Please, I'm interested in the
Please,
topic
your
you are-
radio needs to be
Always
off
turn
when
off your
you're
radio,
calling.
please.
Can you do that quickly?
Sorry.
All right,
I'm
sir.
interested in that topic you are treating this morning.
Okay, sir.
So I'm not a woman,
Of course.
but I have somebody who has done the surgery.
Okay.
And he was telling me that they told her that she must conceive between, later one, at least 10 months to 1 year after the surgery.
Okay.
I
Okay.
want
That
to
she
know
should wait. She should wait after 10 months.
No, that she must make sure that she conceives.
How do you make sure that you conceive?
That's the part I don't get really. So who told her that? Who told her?
That some people are saying that anybody that does
Oh, okay.
surgery for fibroid must make sure that.
Oh, that they have
Okay.
another child about 10 months after that. Oh, okay. That's one of the myths, we might say. Let's hear what the doctor thinks. So after surgery or after treatment of fibroids, you need to have a child immediately. What does that do?
No, you don't need to have a child immediately.
About 10 months?
Except the reason for getting the fibroid removed was infertility in the first
Okay,
place.
okay.
Because some people take off fibroids not because of it's causing infertility to them. It's just because maybe they are symptomatic. So if a 20-something-year-old girl had to take off a fibroid, are you going to tell her you must get pregnant? So if the primary reason the lady had the fibroid taken off was because it is causing some level of infertility for her, then it is advised that you should try and get pregnant as soon as you can.
Right.
You understand? Just
To be
'cause-
sure that the
yes,
problem has been taken
exactly,
away. Then.
and just because fibroids, they tend to grow back.
Oh yeah.
Yes. So even after it's being taken off, it is not, knock on wood, that it's not going to come back. So they tend to grow back sometimes. So the only thing is, we'll advise, if you get it done, we are not going to wait so much time waiting, because they're coming in already. They are anxious to get pregnant.
Right,
So if the
right.
cause of this infertility has been removed, you're advised to
try.
and get pregnant. Yes.
Indeed. Let's take this call before we head out to a break. Hello, good morning to you.
Hello, good morning.
Yes, good morning.
Morning.
Yes, my name is John.
Welcome, John.
Yeah, I want to ask Dr. Ify, what's her view regarding alternative therapies that have been recommended by the WHO for years regarding fertility?
Infertility as a whole or treatment of fibroid?
Treatment of fertility. The topic, I believe, is both for fibroid and infertility.
Absolutely, yeah.
Yeah, so for fertility as a whole, probably to enhance the success rate of the fertility. Yeah, so my question is, I know I've made research. World Health Organization has always recommended a lot of alternative therapies that could also assist and aid in success. So what's the view regarding
What
that?
are the alternatives? Because there are lots of them.
We have homeopathy, we have acupuncture. Okay, yeah, because I've read stories where acupuncture is even used, especially in the United States. About 50% of the United States residents use acupuncture as their therapy. Even they have the HMO that even covers that. I've also had issue of homeopathies and many other that have been recommended. In fact, if you go the recommended list of World Health Organization or alternative that can assist fertility. So I'm just in that area. What's her view regarding that?
All right, John. Thanks for calling.
Well, my personal view to it is if you can afford it, do it. Okay. Nobody is. I personally am not against it. Okay. There have been testimonies really of acupuncture helping fertility. Yes, not just acupuncture. Hydrotherapy has also been, even detoxification. The very popular one, which I know that we use in my center, is Maya therapy as well. Okay. So
what does that mean?
Well, Maya therapy is a type of practice that helps detoxifying the entire body. Okay, so there are lots of things you do, including the hydrotherapy is there. You can do sea oxygen, which helps the mitochondria, in our cells. You can do infrared, has been discussed to increase fertility. So yes, I am very open to alternative forms
therapies.
Yes, you should. I mean, if you, like I said, some of those things here in Nigeria are expensive.
Right.
Yes. So if you can afford it,
and they're safe, just be sure that
and
they
are
safe.
very, very safe. All the ones I've seen, like the Maya therapy, which we practice as well in my center, very, very safe.
We have loads of comments coming in on Facebook. Wemimo will take a few before we go to break right now.
Olabode Michael here says, what's the effect of fibroid? Okay, let me leave the question and just take a comment. We take the questions when we come back. Machiavelli Ifedigbo says, good morning all. I'm making a recording of this topic to play for my cousin. No, don't record. Just copy the link to the video when we're done and send. She can watch the whole show. She's had fibroid for years. Her tummy is like... she's 12 months pregnant and she's refused any form of surgery. Oh, gosh. Says, hi, and my family members have offered. And she says her pastor says she will die if she does surgery. And instead, she should bring 200,000 naira to buy materials to use to pray for her so that she can pee out the fibroid.
No, that's not what that says. Actually,
that's what I just read.
That's
for her to pee out the thing.
That?
She's got fibroid. A pastor tells her to bring 200,000 naira to buy materials that will be used to pray for her so she can pee out. The fibroid will kind of melt.
Right, just pee it out.
So what is his question now? Can she pee out the
Can she pee out? Can you pee out fibroid?
Is he serious, right? Of course you cannot pee out fibroids. Okay, so if the cousins, I believe it's the cousin, right?
Yeah.
If it's that symptomatic, and please tell your cousin to go and see the nearest doctor. Okay, they will, even if it's not a gynecologist, they will refer you to a gynecologist that will take care of you. There is no peeing out fibroids. They are masses. Like I said, they can be as small as beans and they can be big as melons. So there is no peeing it out, and that 200,000 is one step forward in the right direction to getting it done, and not to take it to the pastor that would pray for you with it.
To pee it out.
Exactly.
Guys, big question for you. Can you pee out fibroids? Well, let's do that for a break. We're back with more. There are more interesting questions here on Facebook.
Right.
We'll be reading them when we come back. This is the Morning Crossfire, and today we're looking at fibroids and infertility on the show today. The phone lines are open again when we return. WhatsApp number is 08095975805.
All right. We're back in a moment. I'm Sheriff Quadry.
And I'm Wemimo Adewuni.
#1 talk news and sports station. This is the Morning Crossfire with Wemimo and Sheriff.
Before the break, a very important and very interesting, you can even call it hilarious, comment on Facebook. Can you pee out fibroids? Someone paying 200,000 naira to get prayed for. I personally think you should pray if you believe you should pray. But when there's a medical way out, don't spend all of that money waiting to pee out fibroids. So welcome back to the show. We're talking fibroids and infertility on the show today, and we're reading your comments online where we're streaming live on Facebook and YouTube. Nigeria Info FM, Nigeria Info 99.3 precisely. You can find us there. Welcome back. I am Wemimo Adewuni.
I am Sheriff Quadry, and please share the videos that we're streaming live with you. Share it with people because you never know. A lot of people need to hear what is being discussed right now.
Right.
As you can see, somebody's putting money together to go get some prayers to pee out fibroid. You can imagine the sentiments, the myths out there. And exactly, that's one of the reasons why we have brought up this topic, so we can have a clearer view of what you can do if you're in this position. It doesn't matter whether you're a male or a female, you must have somebody who needs this information. So please take it down and share the word. Spread the word that they can join us right now on this conversation. You're welcome.
Right. We have Dr. Ife Atuchukwu with us in the studio from the Medical Arts Center answering our questions on fibroids and infertility, and she explained quite a number of things. So one thing I drew from that last question or comment is that so many people still have a big fear of surgery. Which I think is what this is riding on. She doesn't want to have surgery because she thinks she'll die if she has surgery. This also runs to people who have issues with delivery, who don't want to have a CS because they think they might die, and they spend a lot of time praying not to have CS. How dangerous or how risky is having surgery to remove fibroids? Is it too dangerous?
Well, like every other surgery, they have your risks to everything. Okay, whether it's a cesarean section or myomectomy or any other form of surgery, even a hip replacement surgery, they have risks to it. But of course, if you're going to have a fibroid surgery done, you would want to make sure that the person doing it is an expert.
Right.
But because all these other stories that we hear, they had a fibroid, and I've seen someone that have come to me, and by the time I did a scan for the person, I found out that not only were the fibroids taken off, the entire womb was cleared. Yes, and she wasn't even told.
The doctor removed the whole womb.
Exactly, and just left something so minute that, of course, never in her life can she be able to have kids.
Okay, so she went to a quack, I think.
Exactly. So the thing is this, like I said, all surgeries and everything you go through have risks.
Right.
But of course, if you're going to a specialist, the gynecologist surgeon that knows exactly what he or she is doing, that minimizes the risk by more than 90%.
Can all fibroids be removed?
All fibroids don't necessarily have to be removed. Okay, so there are two things you want to know. The thing about fibroids, people say it's big. It is not necessarily the size of this fibroid that matters.
Okay.
Don't take it of me that size doesn't matter, but as it pertains to infertility, which is why I'm here, it is not all fibroids that need to be removed, because you can see very big fibroids and they are sub-serosal. You don't want to take them off because they are not affecting the cavity, the endometrial cavity where implantation happens. Okay, but you will see a smaller fibroid, but it's submucous. It is distorting the shape of the uterine cavity, or it's actually completely blocking it off. Okay, so
you have to remove it.
Yes. So even though it's a bean size or it's a cracker size fibroid, you still need to take it off.
Right.
You still need to.
Let's talk about whether fibroid can cause miscarriages. Is that a possibility?
Well, it's been said, the word out there is that when you have huge fibroids, you have miscarriages. But the fact still remains that that is not really true. Okay.
It isn't?
Yes, because there's a recent study. What school was that in? I think it's in. Is it in Vanderbilt, some university somewhere, that did the study in 2017?
Okay.
and they actually found out that a woman with fibroid has equal chances of having a miscarriage as a woman that don't have fibroids.
Wow.
Yes, but growing up, even when I was in medical school, once you have fibroids, you are the higher chance of having,
You have that panic.
Exactly. But this study, like I said, just 2017, it happened in the Vinterberg School. I think that's the name of the university that carried out the research. And it said that, you know what, it's not necessarily so. Not necessarily so, yes.
One of the things I also learned or gathered while doing that report is when you have fibroids, you said not necessarily the size, but when you have fibroids that's really that big. The lady I interviewed said the doctor said to her that she should try to conceive and have a child before doing surgery, because doing surgery for fibroids reduces her chances of having a child afterwards.
Well, because it may affect the endometrium again. Because the thing about this endometrial lining is that once it's scarred, it's scarred. It doesn't grow back, the lower layer of it. Okay, so that's why people that have had maybe series and series of DNCs, when you continually scratching and it is scarring the lining, the chances of getting pregnant also reduces. So for the doctor to have said that, first of all, the position may have been very, very tricky, and possibly the size also. So there are a lot of things I'm sure this consultant must have put into place before advising, because the truth is that she can actually get pregnant. It's not necessarily that you must all the time need to take this fibroid.
But she did get pregnant. She had a very small baby who is, again, living with disability. Does that have anything to... She thinks it has something to do with the fibroids, does it? Could it?
Well, maybe. But again, disabilities, you have to also put into consideration the genetic factors. You understand? Yes, of this baby, because it's not just the position. Like I said, women have had huge fibroids and have gone on to have all the babies that they want. So if you need to know if this disability is coming from the chromosomal level.
Right.
Yes. So there's a lot of things you have to
consider. There's Victor on Facebook who says that he would like to know that if someone has had multiple abortions, is she prone to having fibroid?
Multiple abortions?
Right.
No,
there's no connection.
No,
there's no link between multiple abortions and fibroid.
Never.
Okay.
No link at all.
Another question from Facebook. Adewali Aziz Shoremeku says, is there any link between serious colic pain in a girl child? That thing that babies have. She says there's a link between serious colic pain in girl child and fibroids when she grows older. He says he's a worried father asking this question.
I didn't get that. So, the colicky pain that children usually
have,
yes. Like babies.
Yes. If a girl child has serious colic pain, could that lead to her having fibroids when she's older?
No, because colic pain comes from the stomach, right? It's the stomach down to the intestine and all of that. Fibroids is strictly restricted to the uterus, so I can't make that link at all.
Elvan Godson Ofomokoro says, welcome back, Wems, thank you. Says, a doctor has advised someone very close to me who's got a fibroid that she should go ahead to conceive so that both fibroids and baby will grow together, and then later she would undergo CS to remove both the fibroids and deliver the baby alive. I think we just answered that question. There is a possibility, right? Machiavelli Ifediwo says, I know you definitely can't pee fibroids, but she needs to hear you guys. It's funny, she can't even afford 50K. Wow. Says the doctor should assure her surgery is safe, and if you need her details, I'll provide them. Well, like the doctor has answered, if she goes to a good hospital,
she should go and see
and see a specialist. If you can't afford private hospitals, go to a general hospital.
Yes.
It's safe. It's quite safe
because these consultants are experts, and they come in, they have these surgeries done.
Yes.
You can. It's really is very. It's a very good topic we're talking about this because there are women that have come in and have someone somewhere in, I don't know where they say this lady is from, had been doing this fibroid surgeries for them, and had been, I don't know what they say, she inserts and yanks something.
Oh my goodness.
So they are coming in with a lot of infection.
Of course.
And they're coming in with some of them are actively even still bleeding,
wow.
and some of them have had some corrosive, so I don't know what corrosive agents poured into their vagina. So so people are seeking ways to actually have this fibroid removed. But you see, the thing is knowledge is power. You need to know that you don't have to go to all these quacks to get this thing done. You understand? Some of them, they even give them things to drink and tell them, all sorts of concussion. If you take it, it will shrink the fibroid. It would, like today I learned, pee it off. But
Dr. Ife, perhaps let's do a policy analysis a little bit. Since this is common to black women, would you advise that maybe there should be some specific public policy, government policy, to say that, reduce the cost of the procedure to get fibroids removed? Is that a way to go? This will reduce drastically the number of people seeking quacks to help them out with this.
I completely agree, because fibroid surgeries, they are not cheap. Okay, it's not. On the average, I would say, to have a fibroid surgery done in a very good center, you're looking at almost 600, 700.
What?
A very good one.
Yeah, a very good one. Remember, I said a very good one. And that is because most of the time, before in the olden days, when you do fibroid surgery, they literally have to cut you open and then go through the uterus and cut it and
like you're having a cesarean section.
But now there are, of course, more modernized way to get the fibroids. Again, depending on the size. So if it's not that huge, if it's very big, or they feel it has some sort of size, it's sizable, they may do a mini lap. But laparoscopy these days, it's just very small incision close to the navel area, and they just insert it and then take it off. So it's because of the technology. That is why it's now very expensive, because you need those instruments to have it done. And of course, it is safer than an open myomectomy. So meanwhile, myomectomy is the removal of the fibroids from the uterus. So it's safer, because when you're doing a myomectomy, you have to be worried. Those fibroids, they are very big bleeders. They bleed a lot. They have lots and lots of blood vessels in them. So, when you're cutting, there's always, I remember when I was doing my house job, anytime we're going to go for my myomectomy, we must have at least 4 pints of blood waiting, just in case. Yes, because you just need to have these women get transfused, because they lose a lot of blood. Yes.
Let me take another question from Facebook. Rafael Adegoke says, I've once heard from a medical doctor that not having sex early enough is also one of the causes of fibroid growth.
They have come again.
That is if the woman is from 30 years and above.
They said fibroids is common with nuns just because they are not sexually active. And then they now grow and occupy the space where the baby is supposed
Should
to
have
be.
been.
There is nothing like having sex. What is having sex early enough? Seriously.
He says from like 30.
From like 30. I don't understand. Should you be having sex earlier than 30 or after 30? Then you should.
Well, maybe you should clarify, Raphael.
He's probably just saying that you should have earlier than 30.
Oh, okay, maybe
to avoid.
That would reduce your risk.
Yes.
Okay. The answer to that question is it doesn't reduce your risk or increase it either.
Right. Let's go to the phone lines. Hello. Good morning to you.
Hello. Good morning.
Yes. Good morning.
Thank you for picking my call. My name is.
Thank you for calling. Welcome.
This is the lie they told my brother before he married again last week. That because the girl is above 30 and you have sex, that's why I asked that. And when the baby grows, it pushes away. And it's not fibroid. I can't remember the name. At the end of the day, we operate it. It looks like a mask or like a ball. I can't remember the name of it.
Okay.
What is the problem now? You mentioned something that make me call. You say if the girl is not pregnant, it will go again. So the thing grows again. Why they are waiting for another 6 months before playing the game of shad? Now the wife is now hiding the secret, taking care of the thing with her mother. Now my question now is this: I now help my brother to look for a new doctor to find out what is the problem. The doctor now said there's a probability that the thing has affected the womb because I stayed there for like 7 years. And if they look for all means for his wife to have pregnant, that the baby may deform. Is it true? Or is it yes? I don't even know what.
All right, let the doctor answer that.
Let me try to summarize for you. Okay. So his brother has a wife who had fibroids. I think she had it removed, but she didn't have a child in time. So they believe the fibroids grew back because she didn't have another baby in time. Now she has fibroids, and the doctor is saying if she tries to have a baby with the fibroids now, the baby might be deformed.
There's a chance that after the surgery, like I mentioned earlier, fibroids do grow back after surgery. Okay, but then again, her having fibroids may not be the only reason why she's not getting pregnant. You get, so it's not. I think their problem is that they are assuming that the fibroid is the sole reason why because then taking it off, if there are other reasons why she's finding it difficult to conceive, of course those ones will persist, and nobody is looking into them. Yes, so
he mentioned deformity as well. Is that a thing?
That if you have fibroids,
you get pregnant while you have fibroids. The baby grows and the fibroid is still there. The baby might. I asked that question earlier.
Similar to what the person asked before. Okay, so deformities again. You go back to the roots. Are they genetic? Is it something that has to do with the genes? I mean, you can't say that because there are women that have had huge fibroids. I keep saying it. Right. They have had all their babies, and all the babies have come out perfect,
healthy.
Yes, and very healthy.
Right. Hello. Good morning to you.
Hello, good morning.
Good morning.
Sorry. Good morning, Wemimo.
Good morning.
Thank God I was connected to speak because I'm very interested in what you are talking about this morning, which is fibroid. Sometimes we don't make some research. There is something somebody said, and I thank God, Wemimo, you are good at researching things. You know, he said something about paying for school fees. With rice in Thailand, and you Google it, and it was true. So I want to make my contribution short.
Okay.
There was a documentary I watched. I'm Kingsley calling from Sweden.
Oh, okay. Welcome.
Yeah, there's a documentary I watched that was conducted in United States about this particular thing. Mm-hmm. The relaxer women use is one of the things that causes fibroid and infertility. They have conducted that research, and it was true. So I want you to check. If I check, I will see the video. I will send it to you. Maybe it can go to
Kingsley, I've heard of that before, and it's part of the questions that we have here for Dr. Ife to tell us whether it's true or not. But thanks for calling. Please keep listening, Dr. Ife. How true is this? I've heard that there is a component, there is a content, an element in relaxers, hair relaxers that women use, and that could just be one factor out of many.
Like you said, I have heard it as well, but
I'm checking it up now. It's a study. This was published in 2012. It's a study published by the American Journal of Epidemiology that reports that the use of hair relaxers may increase the risk of uterine fibroids.
Yeah, the word there is may increase. Yes. So because we have not had our own research here, I can't say yes, it is true. But have there been studies that have said that? Of course. And should we look into it? I think we should look into it, because if we are able to come out and say that this for fact is this because we have done this research, and it comes up that it actually is, then you can now say, okay, can we remove this agent from these relaxers? Or is there a substitute
but
for
since
that?
2012, we should have looked into this. 8 years going.
Who is going to fund the research is the thing. That's where, we are pleading to the government to, intervene. Because as you can see, it's almost as if the fibroid is the disease of the black woman.
Right.
Yes, exactly.
Indeed. hello, good morning to you.
Yeah, good morning.
Yes, good morning.
Yeah, my name is Adewuni. I'm calling from Sagada.
Welcome.
Seriously, doctor, you're welcome.
Thank you.
What's of major concern to me is the effects and the problem these pastors have actually caused to their devotees, both in this instance and some other health-related issues. I have a situation where even a colleague in the office could not have his wife delivered through CS of a baby because the doctor says said if she does that, she will die. And then here he was trying to get a loan to do. I insisted that for you to get that loan, we may have to pay it through the medical, the experts,
right.
not
directly,
not the church or either.
Right.
And these are. It's happening everywhere, so we need to talk so much about sensitize people on these things. That is not to say that God cannot do a lot of things. God can do all things. But what is required, I know to the best of my knowledge, what is required in prayer is faith and an ardent prayer, an earnest prayer. That's what the Bible says. And none of these is bought with money. So if a doctor, if a pastor, any man of God requests for money for any kind of prayer, whatever it is, that should give you a red line that this
something is wrong. That should be a red flag.
Just trigger some kind of alarm, right?
Thank you so much for that. And let me add.
Thank you.
Let me
Thank
add
you
to that. Recently, thankfully the letter listened, and which is very true. I'm also a Christian, so I don't see a problem with you praying. But like I tell people, medicine and science is a miracle. So for those of you who believe in prayers and believe in God, God made it possible to say, hey, see how it can be done. So you can pray while the medical part is being done. Someone had mental challenge. The family left him in the house. He almost burnt down the house. And guess what? The religious leader told them that they must not take the guy to a psychiatric hospital unless he agrees. So don't take him there. Just leave him in the house until he kills everybody in the house. So while you believe in these people, also, apply a bit of,
Yes, you're very right. Faith is good. Because even all doctors, or at least personally for me, I always operate with faith. Yes, God is very real. But the thing is, you need to differentiate what God has given you to help people. And, we need to tell these people that prayer is good, but you need to seek medical advice and medical intervention when you need it.
Right. Emma on Facebook says, my auntie died after her surgery. It was said that after the doctor had opened her body, he then realized that he needed to take both her womb out, which was not in the initial agreement. So at that point, he paused and started covering the part he took. He cut back so as to have another talk with the family about the womb. Now, this took hours because she was with her friend in the hospital, and it took hours before he reached a family member to sign. Finally, she even regained consciousness and overheard the doctor talking about her womb being taken away, which she refused. Meanwhile, her body has been cut already. After she was finally convinced, she agrees. The doctor continued.
This sounds messy. So a doctor starts surgery, suddenly realizes he needs to remove the womb, pauses the surgery, sews back a bit of the part, leaves her there on the table, goes to negotiate with the family to sign, comes back, she says no, goes back, leaves her on the surgery table. Somebody should be suing that doctor and that hospital.
Or better still, what is the practice? What is best practice?
What was that? What happened?
Okay, in very rare cases, you may go in expecting to see one thing and you see another thing. That happens in surgery. It's not just fibroid surgery. It happens even in open heart or whatever surgery.
Right.
Sometimes you may have that case. Okay, and the practice is that you need to have consent, really.
Okay.
You need to get the family's consent, because guess what? The lady can actually sue you if you take off her uterus and not tell her.
Right.
Okay, so him going to, I didn't see, perhaps, I don't know the length of time that took to do all of that.
Hours?
Hours.
Hours.
Well, no, usually the family is in the waiting room. So it's something you go, see what's the new
He said it was a
development.
friend that was in the waiting room, so it took hours to get the family members.
Oh, well, you see, and when you're having such a major surgery, you don't come to the hospital with your friend. You come, if it's a lady, you come to the hospital with your husband, because
if you're married.
That's if you're married.
What if you don't have a friend or a family member?
Well, you have to have somebody that will have signed the consent, because before you go to all this surgery, consent forms have to be signed.
So if the friend had signed consent, why couldn't the friend further continue?
Exactly.
But we need to move on quickly. Unfortunately, another sad one on Twitter. Lala here says, I lost my elder sister last year due to complications arising after fibroid surgery. They said it's DIC. And afterwards, she had renal failure. And before dialysis was done, she passed on. She said she wishes she had lived with the bleeding instead of having the surgery. I'm so sorry about your loss, Lala. Another comment here, Joy Forever says, fibroid is an issue and many people are very afraid. Some believe it leads to cancer. A lot of people go spiritual about it. Also, herbs are being wrongly prescribed as cure. Fear is another factor to operate. Okay, I'm sure you mean for surgery. A final one quickly. Can we squeeze one in from Facebook? Can we?
No, we can't.
Please. No, we can't. Unfortunately, we're out of time.
Let's tell them again that fibroids are not cancerous.
Right.
Please,
it doesn't lead to cancer.
Yes, we can't stress that much. It is not
Please,
cancerous.
I need a quick answer on this from you. Elvin Gotten on Facebook is asking, please, doctor, is womb transplant possible to replace a damaged one?
Well, yeah, if you get a good womb that you can, of course.
You get a donor.
Yes, you can get it. We don't do it here. Hey, Nigeria, we don't do it here.
Why?
But yes. Well, because we don't have the expertise, I guess.
Right. So if you have the money,
yes. But if you have the money
and you find a donor,
yes, and you know, because it's just like having a renal transplant or kidney. It's the same thing.
Right.
Yes.
Right. Let's leave you now. We hope that we've done justice. And if you have more questions, please see your doctor. Dr. Ife Atuchukwu has done quite a lot with us on the show today. Thank you for coming in today.
Thank you.
She's from the Medical Arts Center, and thank you all for joining the show.
Here.
You were fine. See, we're back tomorrow with more conversation, but here's 99.3 Nigeria Info. More news, talk and sports coming up just after the break. See you tomorrow, guys. I'm Wemimo Adewuni.
And I'm Sheriff Quadry.
Join us at 6 a.m. tomorrow.